So now I want to discuss a little bit before talking about a breast biopsy. I want to discuss about the breast cancer formation. So breast has a duct, and through the nipple, the duct goes down into, there is a gland which produces milk. So it looks like this ductal shape, and inside there's a lobule which composes of the gland. So when depending on the cancer formation, we can call as a ductal cancer, which the tumor forms, the cancer arises from the duct, or it can arise from this gland, or milk-forming gland. That is because it's low, we call it as a lobular cancer. So let's see a little bit of review for progression of breast cancer. So in the normal case, there is a normal duct wall and normal epithelial cells. And sometimes over time, it can become atypical hyperplasia. Hyper means it has more number of cells. You see the number has been growing. So this is kind of abnormal, but still we don't talk this as a malignant. So it's still benign stage. However, the cells become like grow much inside the ductal wall that we call in situ, because it's a cancerous formation is making in its original location. The practical difficulties is finding out this cancer cell breaking the wall. It's not very easy all the time because we are sampling. So if we find this, we call it as an in situ cancer, and this is regarded as already malignant. Of course, when it becomes metastatic, it can have a hematogenous metastasis, meaning that the cells can come out of the tumor and into the circulation. So in these breast cancers are arising from epithelium, so neoplastic cells proliferate in their normal habitat, and that in situ we call it as, because it's originating from epithelium, I talk about it as a carcinoma. So we call it carcinoma in situ. So how to find out this breast cancer? So to diagnose the presence of cancer, we need the definitive way is really take out the tissue and looking at under the microscope, confirm that there's a cancer-like cells presence. So that taking small samples of tissue, which is surgically removed, so that we can judge the type and stage of the tumor can be determined. And that we call as a tissue biopsy. So here I brought some examples, especially for diagnosing breast cancer. So let's assume there's a lump was detected, or from mammography, there's a suspicious lesion. Then there is two different ways. So first is called, you look at this flexuron, and finally a needle suck into the lesion, and then we suck the cells out. So that we call as a fine needle aspiration, so, or FNA biopsy. This is rather easy and quick, and you can see, and this FNA fine needle aspiration, it's because it's aspirate, so it sucks and the cells, and you spread it, and then you observe. Because of this, we only see the shape of the cell. We do not have the context. So the limitation is it cannot distinguish between in situ versus invasive breast cancer. On the other hand, there are another ways of biopsy for breast cancer that is like a boring. So with a rather bigger bore or core, we use core needle as a biopsy. So it's not flexible, it just passes through. So like this way, the other way, the other way. So, and then you take out the whole tissue which is inside the needle, we call it as a core needle. So what's good about this? Then because we can see the actual tissue structure. So we have a more definitive histologic diagnosis is possible. So we can distinguish invasive versus in situ carcinoma. And of course, this, if there is a tumor, they may potentially see it through this needle track. So there's a potential theoretical risk.